I got what you're saying about how to step in and make sure that nobody steals your cornbread. How to step in and make sure that nobody messes with you from the get-go. I missed that episode. I'm 2 years in. How do I get out? How do I turn a page? I can't take this. How do I make a 180-degree change? Boom. Fix that one, Dr. Bilbrew.
So here's the thing, like, and I'm a realist. You can't. If you 3 years in and now you're being bullying, I think there's two ways. And so you're being bullied, but you're a strong resident. There's no risk of you being held back, of you being fired. Hey, you're going to get through this program, but it's terrible. And you still have another 2 years left. You have to make it through at this point.
So you just accept it?
I'm not saying to accept it. You have to accept that it is a part of your process. It's like giving birth. You know, you're like 7 hours into labor and you're like, dang, I got another like 10 hours to go. There's nothing you can do to speed it up.
Embrace the suck.
You embrace the suck and say, I'm here. I'm going to focus on my education. I'm going to focus on maybe using these experiences for the person that's coming behind me at the next stage of where I'm going, that this is not going to happen to me again.
Let's switch. The bullying and persisting in residency. Why does it still exist?
It's a cultural thing. You know, you do what was done to you. It's a trauma response, essentially. I
survived, so you should too.
Exactly. And I've been told that by attendings, like, I got through it, so you can get through it. And I'm like, but it seems like you're scarred, right? And it takes, when I say like you got to be a martyr, and I hate that because it means that like you died, but like sometimes you have to be that trendsetter, and you have to take those whips and those licks to really be like, no, y'all not going to do this to the people after me. For me, it was once I got to be, you know, a fourth year and a fifth year where I'm teaching, I made sure I didn't teach out of fear, you know, like, okay, I got to make sure y'all do good, because if I don't do good and the attending is going to be upset. And no, we going to take our time and learn how to do this the right way. Because if I teach them with that patience, that kindness, that empathy, they're going to do the same. But if I teach them the same way I'm taught, what if they don't have the same, you know, emotional intelligence, and then it's worse, right? And I think that's what happens in programs like the Jägermeister, is that you just had these emotionally unintelligent men. But no, seriously, it almost got worse generation after generation. Because it just got more and more malignant. And you hear that word with programs of malignancy, like it's a toxic program. Like in medical terms, it's cancerous, right? There's something in the culture of that program. And it's like, no, you have to be the chemotherapy. You have to be the change setter. And that takes a lot of strength. I always go back to a village. It's not something you do by yourself, right?
Because did you have a line? Did you have a line like a line in the sand where you're like, whatever happens is going to be like, nah, like NAW.
Yeah.
What would that be? Because I mean, there's a lot of pressure on you. Dr. Bilbrew, I saw your previous, hey, can you just tell us your previous history, or excuse me, your family history, right? They were farmers in England?
Oh, yeah. So I come from, you know, I'm second generation British born, but my family's Jamaican. So my grandparents were like farmers in Jamaica. We came from, when I talk about the part of Jamaica that my family is from, Jamaicans are like, do people live there? It is rural. It is, sometimes the water is running. Sometimes the electricity is running. It's like the poorest of the poor. And I don't say that in a bad way. It's to say like, we came from the struggle. Right. And so I think that builds in you a certain strength and a certain grit and resilience. But I also know that may not everyone is brought up that way. Right. And so you can't, the hardness that I'm like, just get through it. That's not realistic for somebody.
Well, because, you know, the thought process is, oh, listen, man, my ancestors, like, they ain't put up with no running water for me to, like, not be able to take this Jaeger. I'm taking this Jägermeister so I can finish this program, right? Hey, Dr. Bilbrew, come on now. So talk to me about that. Like, what is your nah? Like, I ain't standing for that, right? Because I bring that question because that's a struggle that a lot of people have. Like, my family didn't send me here for this, or my ancestors didn't send me here for this, or, you know, I got loans.
Exactly.
You know?
Make it.
Like, take us through that. Talk us through that, because that's really complicated.
You know, for me, the line in the sand was, if they ever said, my program was really big on, we're going to hold you back. And for me, that was my line in my sand, because I knew that I was giving everything that I had, like 150%. And if they turned to me and said, And I'm even talking with testing, like, hey, so what if I didn't score in the 90th percentile? But if they said to me, hey, Dr. Bilbrew, we think that you are just not performing and you need to repeat third year, that was going to be the end of my orthopedic career. Because
At that place.
At that period,
Stop playing.
because it's very hard to find a place where you
Program.
can just transition straight into your fourth year. Most likely you're going to have to repeat somewhere else anyway. And I said, I can't. Not just because of the rigor of the training, but no, I've given you the best of me. Like my mom always says, I gave America the best of me, which is like me and my
Gotcha.
sister. But like, I've given the best of me. There's nothing more to give. I would break that. That was my mental threshold. I would have broken down mentally. I would not be the same surgeon I am today if I had to go through the process, knowing that this has nothing to do with my surgical skill or my knowledge, or it has everything to do with the fact that somebody don't like me. Somebody doesn't want me here. And that became a snowball effect that led to me being held back. That was my line in the sand. Wouldn't do it. I would have found a different career. I'll be on CNN with Sandra Gupta, top medical correspondence.
So you wouldn't even do another specialty, like, because general surgery. No,
I would not be board certified in anything. I knew that I enjoyed and loved orthopedic, maybe dermatology. They got a good lifestyle.
General surgery. The derms they got good lifestyle. Opto.
You
they
said
got
general
good
surgery.
Yeah, general surgery. Come on now, stop playing.
That's also torture.
No.
I love my general.
That's your gnaw. That's your second gnaw. Gallbladders? Come on, that's you, Dr. Bilbrew. Come on now, you got this.
Listen, I don't want to deal with poop. The clinical exam alone, I'm like, I have to touch what and where? Like, I don't necessarily have to wear gloves when I do my exam. With y'all do, you wearing gloves. You wear the whole bodysuit. I'm just not.
Yeah, it'd be nasty in there. It'd be nasty in there.
There's smells. And then the second line in the sand for me was any type of sexual harassment, whether that was physical or verbal. Because I worked in such a male-dominated field, like you always have to assert yourself as a woman. But that's just something I was not. I mean, in any situation that I was not going to put up with, just on the ethics of it, and also just keeping in mind that if it would have happened to me, it could have potentially happened to other medical students or any other women that would have came through the program after me.
I get it. And mad respect to you. And this has been a really great conversation, because I think, folks are actually leaving with some tools, some tricks that they can use either as they begin residency, when they first see it, to establish themselves, or even, I know we joked around about the person who's in the middle of their residency and they're struggling with bullying. How do they get out of that? I know we didn't offer much, but you still gave tips on that. So just to kind of wrap this up, right? Because sometimes it can be hard for people to recognize that they are possibly applying to or interviewing at a toxic residency, right? And you may just be there. But for the folks, like, to kind of wrap things up, like, give us those tips again.
Sure.
Like, I love the way how you talked about strategize and so forth. Talk to us about that. Keep it objective. Can you just kind of run through those again?
Yeah. So, the first thing I say is, when you feel like you're being bullied, or you had a comment said to you, the first thing you always need to do is pause and digest it. You should really go home and write it down. And this is a part of your documentation so that you can talk about it. The second thing is, you always need the input of your village. Never doubt, just because you're going through, maybe you're the first person that's gone through residency or surgery or medical school, that you should still talk to those friends, families, and individuals that supported you, right? The third thing is, don't ever let it roll over more than a week. Because when it does, as I use the example of my friend, it can follow you all 5 years. It is still appropriate, even if the person doing the bullying is the program director or chairman. It is still appropriate to meet with a person that is in a position of power and authority, to let them know, this event has happened to me or is happening to me. I do not like it. I do not think it is conducive to me having a good surgical or residency training program, and it can potentially interfere with me being the best physician that I'm trying to be, which is why I'm here at this program. That conversation, you always follow it up with documentation in written format, digitally, per our conversation. Thank you for meeting with me. I would like to recap A, B, and C, and this was your solutions to how we can deal with it. The other thing is the objectives. How do you differentiate between, is this bullying? Is this constructive criticism? The way that you do that is really focusing in on, are they trying to make me a better surgeon, or are they trying to break me down as an individual? You know that clearly, just based intrinsically on what you feel in that situation. Even if you're someone that doesn't take criticism well, you almost know when someone is just not being kind, right? It's just back to toddler days. Are you good or are you bad? So in those situations, you want to keep your own tracking data. And for me, I use surgery as an example. How did I perform on this surgery? Look at the objective things. What was my timing like? How do you think I did interpreting these x-rays? How do you go through all of them? Talk with that attending or that chief and document it so that no one can just say, well, I don't think she's good. Why? Right. And when you do that, you're also going to be documenting your good and your bad, right? Maybe you had a complication. Here's the great thing about having a complication or having something go wrong in a training environment. It's supposed to happen. Here, I'll give a personal example.
We love examples.
We love
examples.
Ankle fracture dislocation in orthopedics, when someone has what's called a trimalleolar ankle fracture dislocation, your job as the intern second or third year that is in the emergency room is to reduce it, to splint it, to then either keep the patient or send them out. I had never seen this particular type of ankle fracture dislocation. And I was also afraid to ask for help, right? Never be afraid.
Yeah, that's a tough situation.
It's tough when you don't want to seem like you don't know. But again, you're in a training program. You're not supposed to know. And if they're making you feel like you're not supposed to know, that's when you have to let them know, no, you're here to teach me. Sometimes you got to remind them.
Because some places you feel like if you ask a question, if you show some vulnerability, if you show some, I'm weak in this area, it could be used against you later on.
Yeah. And I'll say the best surgeons are the surgeons who are vulnerable enough to admit their weaknesses. The best surgeons are the ones who are like, you know what? I'm not so great at that procedure. You know what? I still have to read the book before this. Those are the best surgeons with the least complications because they take the time because they're humble, right? So back to this example. I splinted this fracture dislocation and the ankle was still dislocated, right? So when the next morning, we have something called fracture conference where you bring up every x-ray that comes up. And this is how I was dealt with when they brought up the x-ray. I was like humiliated. I was shouted at. And I remember the trauma surgeon at the time, she finally turned to me and said, you don't know that you're not supposed to send this out? This is after like a 10-minute berating. And I said, honestly, no. I'm not familiar with this fracture pattern. I had never seen it before. And I said, I would really appreciate if maybe after this conference, we could go through some case studies and you could show me the techniques on how to best deal with this particular fracture. I've never seen it before in my 2 years here as a resident.
Dr. Bilbrew, why are you so mature? Oh, I hate you.
Because the ancestors.
I hate you. I'll be sitting there like, I would have just got mad and left. I love that answer. That's a great comeback.
Yeah, because I was just honest. Like, no, I didn't know that I wasn't supposed to send it out. Now it's different if I had seen that particular fracture pattern even twice, that's on me. Because you've seen it. Your job is to learn and absorb. When I said that and I met with her mouth dropped. Because now she realized she had failed as the trauma attending to teach the second year how to do how to recognize a particular fracture, then how to deal with it, right? And she was so intimidating that I didn't even feel comfortable to call her to say, "Is this correct?" Right? It completely changed it. Now she was still hard on me for the rest of those 5 years, but it did change the dynamics that she dealt with me a little bit differently than she did with other individuals. So those are
I
my
love that.
examples, ask for help, be
I
vulnerable,
love that.
document, just like how we have to do that for the medical record. So those are some examples of the things that you can do to protect yourself from bullying, to strategize around bullying, and to ensure that you have it's not always going to be smooth, the training process. People are people and they have their flaws, and it's a cultural issue. But if you document your experience, that's also the ability for you to reflect on what's going on and to also help to direct individuals on how you need them to interact with you. And you'll use that from residency to fellowship to early practice and even into your personal relationships. Because sometimes when somebody offends me, I'm like, take a second, pause, deep breath.
Stop technique.
Right, exactly. Before I jump off with 4-letter words. So yeah, that's that's my time.
Hey, so Dr. Bilbrew, she knocked this out the park. Listen, real quick, let me give some resources, some additional resources. Then we're gonna talk about your book real quick. Listen, guys, there's like the takeaways that you're getting from Dr. Bilbrew. Those are amazing. I also want to add that there's also support groups that you can get from your peers, right? If you feel comfortable with your peers, you can talk to them about it. There's mentorship programs, right? Possibly. There's counseling, right? Don't forget about this counseling and mental health services. There's the employee assistance programs that all residencies have, right? That way you can talk confidentially and address any type of work-related stress that you're dealing with. There's mental health professionals, right? Like therapists. We've talked about this on the show. There's betterhelp.com. There's so many different avenues that you can possibly and affordably, talk to someone who can help you get through this process. You may want to consider getting into some workshops, some seminars where you can talk about some conflict resolution, maybe even deal with some resiliency, possibly. And then don't forget about this reporting, right? Dr. Bilbrew talked about this. There's some ways that you can report this. You can report it up to a PD. You can report it to anyone else who you trust. But there's also anonymous reporting also if you don't feel comfortable with that. And, let's real quick before we get out of here, let's talk about your book. Right?
Yeah.
It's called Yes, I Am the Surgeon, Lessons on Perseverance in a World That Tells You No. Let's talk about that book. When did that book come out?
That book came out, it's 2 years ago now.
Mm-hmm.
And it was a culmination of my experiences from a child all the way until early career just 2 years ago. And I realized that like when I share my story, everyone's like, oh wow, you're this orthopedic surgeon. And I was like, but like there's a strategy behind everything. There's a
Mm-hmm.
blueprint behind everything. And my life really is a collection of different blueprints that I have stitched together that have led me to be successful. And I say that with no humility. Because we
That's
don't
right.
we don't
Big Dr. Bilbrew.
it
There you go. Big it up.
believe
Big it up.
we don't say like, man, like I'm doing it, like
Mm-hmm.
this is a standard, this is the standard. And though I'm always like, hey, I can do more and more, I'm like, no, I need, the purpose of the book is because I need a room full of people that are Dr. Bilbrews. I need a room full of people that are writing their book and they're telling their story and they're like, let me show you how I got through this and I navigated this. Because the presence of having these strenuous situations, these toxic environments, these bullies, it's never going away. It is just a product of human nature. We don't live in a civilization where all kumbaya. We're all going to have struggles. But the book is about equipping you with your toolbox, with the tools that you're going to use on how to navigate those struggles so that you persevere and so that it's not just persevering and saying I made it through and then you're all cut up and bloody, but you say I persevered and your head is held high and you're like, look at what I've been through and I'm proud of it. And I'm not all beat up. I'm not deranged. I'm not emotionally unstable. I can be present for my friends and my family. I'm still the same person and I'm a better person because of it. And I haven't changed for the worse. I'm now impacting my community and I'm changing the culture. And your whole mindset shifts when you walk into a room because now patients be like, oh, the standard is a black girl with locks is my hand surgeon, and unless she look like you, Like, she's the standard. Like, that's what I want. And I'm using that as an example, but it could be whatever your identity is, right? Is that we are more than just the surgeon. We are the culmination of our experiences that dictate how we treat other people. And the way we always need to treat other people is with empathy and care. That's the underlying message.
I love it. I love it. Dr. Bilbrew, Dr. Letitia Bilbrew. There it is. Listen, that book is available.
Bilbrew.
Oh, I didn't know. See, I didn't want to go there. I ain't trying to.
That's always for that chief that got me on my name, Letitia Latoya Bilbrew.
And there it is. There it is. You can find that book on Amazon. And also, we'll put that links to that book as well as your website on the show notes. Listen, call to action, guys. Have you or someone you know experienced bullying in residency? Come on, share that story with us. Let us know so we can talk about it. Maybe have Dr. Bilbrew back and kind of get you through these type of situations. You know, like, here's another thing that we didn't talk about, but maybe we could talk about it on a future thing, is how do you handle, like, when you're being bullied specifically with, like, the schedule, right? Because I know I brought it up, but we didn't really talk about that. But that could be a problem also, right? Those are harder things to, like how do you justify that and stuff and be like, yo, like, why am I taking all this call? But if you are experiencing bullying in residency right now, share your story with us and let us know. Man, this was really great, Dr. Bilbrew. I really appreciate your time. I also appreciate your grind. Were you at Morehouse?
Yeah, Morehouse School of Medicine. I was there 07 through 11.
All right, because I was there. But you were a med student or a resident?
I was a med student.
Med student.
Yeah.
How do we not? Because I was a general surgery resident from 06 to 2011 there.
Who? The guy that was on I don't know what he was. It was a white guy. He was skinny. He used to call us maggots.
Ooh,
or maybe,
really?
Maybe he wasn't. It was a funny thing. I don't know. Maybe he wasn't white. It was.
Okay.
I don't. But that's who I remember as being chief. I don't remember you.
Hey guys, sometimes you're just not memorable. Hey, I'll take it. But at least, hey, you don't remember me for bad reasons. But I was there during that time.
There you go.
Maybe I wasn't there when you were doing your rotation because I was maybe in Columbus, Georgia, or doing an away rotation. But either way, it's great to see a fellow Morehouse
shout out to Morehouse School of Medicine, Morehouse General Surgery Program. Yes. Shout out.
So, guys, listen. Let us know what you think. If you're experiencing bullying, write us in. And also make sure you check out Dr. Bilbrew's book. And once again, Dr. Bilbrew, thank you very much for your time.
Thank you.